Are you a man over 60, experiencing something a little different in the bedroom? Maybe you've noticed that when you reach your peak, not much, or even nothing at all, comes out. This is often called a dry orgasm or dry ejaculation. And believe it or not, it's more common than you might think. Many men go through this, but very few talk about it, often feeling embarrassed or worried. Well, today, we're going to change that. We'll pull back the curtain on this sensitive topic. With the help of urology experts, we'll explore exactly why this happens as we age and, most importantly, discuss the simple, practical steps you can take to understand your body better and regain your confidence. This isn't about fear or shame. It's about providing clear, science-backed information for your health and well-being. So, let's get started and clear up the confusion. First things first, let's define what we're talking about. Dry ejaculation, or technically, retrograde ejaculation, is when semen enters the bladder instead of being expelled through the urethra. During orgasm, you still experience the physical sensation of climax, but little to no semen comes out. It is crucial to understand that this is different from not being able to achieve an orgasm at all. The feeling is there, but the fluid is not. So, why does this happen, especially as we get older? The primary reason is often related to the muscles at the neck of the bladder. Normally, during climax, a small muscle called the bladder neck sphincter tightens up to prevent semen from going backward into the bladder. It acts like a one-way gate, ensuring everything flows in the right direction. However, as we age, various factors can affect how well this muscle works. One of the most common culprits is medication. Many men over 60 are on medications for conditions like high blood pressure or an enlarged prostate, also known as BPH. Certain alpha blockers, often prescribed for these issues, are designed to relax the muscles around the bladder and prostate to make urination easier. A side effect of this relaxation is that the bladder neck muscle might not tighten as firmly during orgasm, allowing semen to flow backward. It's a classic case of a treatment for one condition unintentionally affecting another bodily function. If you started a new medication around the same time you notice this change, it's a strong clue. It is always a good idea to review your medication list with your doctor if you have any concerns. Never stop taking prescribed medication without consulting your healthcare provider first. Another major factor is previous surgery. Procedures involving the prostate or bladder can sometimes impact the nerves and muscles responsible for ejaculation. For instance, a common surgery for an enlarged prostate, called TURP, or transurethral resection of the prostate, can lead to retrograde ejaculation. During this procedure, part of the prostate is removed, which can damage the bladder neck sphincter. Similarly, some types of prostate cancer surgery, or even surgeries for bladder cancer, can have the same effect. The surgeon's goal is always to preserve as much function as possible, but sometimes these side effects are unavoidable to treat the more serious underlying condition. If you've had any pelvic surgeries, this could be a key piece of your puzzle. It's not a complication, but rather a known potential outcome that your doctor likely discussed with you before the procedure. Nerve damage from chronic health conditions can also play a significant role. Conditions like diabetes, multiple sclerosis, or spinal cord injuries can interfere with the nerve signals that control the bladder neck muscle. When you have long-standing diabetes, for example, it can lead to what's called diabetic neuropathy, which is damage to the nerves throughout your body. This includes the delicate nerves that coordinate the complex process of ejaculation. The signals telling the bladder neck to close might not get through properly, or they might be too weak. This isn't just about blood sugar. It's about the long-term impact the condition has on your entire nervous system. Managing your underlying health condition as effectively as possible is one of the best ways to prevent further nerve-related issues and support your overall well-being. So, now that we understand some of the main causes, you might be wondering, is it dangerous? The short answer is no. For most men, retrograde ejaculation is not harmful to their physical health. The semen that goes into the bladder is harmlessly mixed with urine and is flushed out the next time you urinate. You won't feel it, and it doesn't cause any internal problems like infections or blockages. The primary concern for most men is psychological. It can be startling and may lead to anxiety about performance, masculinity, or whether something is seriously wrong. For younger men trying to conceive, it can be a fertility issue, but for most men over 60, the main impact is on their sexual experience and confidence. Understanding that it's a mechanical issue, not a sign of a deeper health crisis, can be incredibly reassuring. Let's talk about what you can do. The first and most important step is to talk to a doctor, preferably a urologist. Self-diagnosing is never a good idea. A doctor can give you an accurate diagnosis and rule out any other potential issues. They'll likely start by asking about your medical history, surgeries, and medications. They may also perform a simple test. After you've had an orgasm, they will ask for a urine sample. If there are sperm cells in your urine, it confirms a diagnosis of retrograde ejaculation. This simple, non-invasive test provides a clear answer and peace of mind. This initial consultation is the cornerstone of managing the condition. It's a safe space to ask all your questions and get professional, personalized advice without any judgment. Once you have a diagnosis, what are the treatment options? This really depends on the cause. If medication is the culprit, your doctor might be able to switch you to a different drug that doesn't have the same side effect. Again, do not make any changes on your own. If the cause is irreversible, like nerve damage or the result of unnecessary surgery, the focus shifts to management and acceptance. There are some medications, like that can sometimes help tighten the bladder neck muscle, but they aren't suitable for everyone, especially men with high blood pressure or heart conditions. Your doctor will weigh the pros and cons with you. For many men, the most effective treatment is simply understanding what's happening. Knowledge is power, and knowing that this is a common, harmless condition can lift a huge weight off your shoulders. It's also incredibly important to communicate with your partner. Secrecy and worry can build a wall between you. Explain what's happening to your body in a calm, straightforward way. Let them know that you still experience pleasure and orgasm, but the physical result is just different now. Open communication can prevent misunderstandings and strengthen your intimacy. Your partner is likely more concerned about you and your happiness than about the volume of ejaculation. Sharing this information can turn a source of anxiety into an opportunity for deeper connection and mutual support. Intimacy is about much more than just one specific physical outcome. It's about closeness, pleasure, and emotional connection. Focusing on other aspects of your sexual health and overall vitality can also make a huge difference. A healthy lifestyle supports every part of your body. Regular exercise, especially activities that improve blood flow like walking, swimming, or cycling, is fantastic for cardiovascular and sexual health. A balanced diet rich in fruits, vegetables, and whole grains provides the nutrients your body needs to function at its best. Managing stress through mindfulness, hobbies, or spending time in nature can also have a profound impact on your well-being and libido. Think of your body as an interconnected system. When you support one part with healthy habits, you support the whole. This holistic approach can improve your energy, mood, and overall sense of vitality, which are all key components of a satisfying life, including your sex life. In summary, experiencing dry ejaculation as you get older is often a benign condition caused by medications, prior surgeries, or chronic health issues. It is not physically dangerous. And the main challenge is often the psychological impact. The most important steps are to see a doctor for a proper diagnosis, have an open conversation with your partner, and focus on your overall health. There's no need for fear or embarrassment. This is a normal part of aging for many men, and with the right information and support, you can continue to have a fulfilling and confident, intimate life. Your health journey is unique, and being proactive is the best thing you can do for yourself. Thank you for joining me today to discuss this important topic. I hope this has provided clarity and reassurance. If you found this video helpful, please give it a thumbs up and consider subscribing for more science-based health tips for men over 60. Remember, your health is your wealth. Take care, and we'll see you in the next video.